The hip joint is one of the most important joints in our body. It allows humans to walk, jump, and run. It bears all of the body's weight and is the force behind the strong muscles of the hip and leg. This joint not only stabilizes the body by connecting the lower limb to the pelvic girdle, but it has a great range of motion. The hip joint is also the second most flexible joint in the body, behind the shoulder joint. The hip joint is a ball and socket synovial joint that allows the body a high freedom of movement due to its unique structure. It lies between the os coxae, or the hip bone, and the head of the femur. On both sides of the os coxae lie a rounded indentation named the acetabulum. The two acetabulum make up the sockets of the joint, while the head of the femur that articulates with the acetabula make up the ball. The acetabulum has two parts. In the center of the depression is the acetabular fossa, which is a non-articular fossa. The articular part of the acetabulum is crescent-shaped and makes up the round margin of the acetabulum. Its circular rim, called the acetabular labrum, is made of fibrocartilage. Because this layer of the cartilage has a diameter that is smaller than the fossa, it prevents the head of the femur from slipping out of its socket, thus enabling its stability. On the proximal end of the femur is a ball-like head which has a small depression, the fovea capitis, which is the point of attachment for a short ligament which joins the femur and the acetabulum. Just inferior to the head is the neck of the femur, which is angled laterally. Inferior to the anatomical neck of the femur are two bony prominences called trochanters. These two trochanters are muscle attachment sites. On the lateral side is the greater trochanter, the point of attachment for the ischiofemoral ligament. The greater and lesser trochanters are interconnected by the intertrochanteric line, the attachment site for the iliofemoral ligament. Distal to the head of the femur, on the posterior side, is another attachment site, like the gluteal tuberosity, where the gluteus maximus attaches, shown here. Inside the joint is hyaline cartilage, which lies on the head of the femur and on part of the surface of the acetabulum. There is articular cartilage between these bones to provide a smooth, slippery surface so that there is no bone-on-bone contact when the legs move. Not only does the cartilage protect the bones from rubbing against each other, it also acts as a flexible shock absorber. Without its shock absorbance quality, the bones would be damaged while walking and running. The hip joint is surrounded by ligaments categorized by location. There is one intracapsular ligament and 3 extracapsular ligaments. The single intracapsular ligament is the point of attachment for the acetabular fossa and the fovea capitis, called the ligament of the head of the femur. The 3 extracapsular ligaments are continuous with the outer surface of the hip capsule. They are the iliofemoral, pubofemoral, and ischiofemoral ligaments. The iliofemoral ligament originates on the ilium and attaches to the intertrochanteric line in 2 places, giving it a V shape seen on the anterior side of the os coxae. The pubofemoral ligament attaches to the pelvis and obturator foramen, located inferiorly on the anterior side. The ischiofemoral ligament is located posteriorly, where it originates on the ischium of the pelvis and inserts on the greater trochanter of the femur. Together, these 3 external ligaments are the foundation of the stability for the joint. As a ball and socket type joint, the hip joint has an incredible range of motion. Its movements include flexion, extension, adduction, abduction, lateral rotation, and medial rotation. It can also circumduct, combining movements of flexion, extension, adduction, and abduction so that the femur can move 360 degrees. The femur can also rotate 90 degrees on its axis. In addition to its wide range of motion, each hip joint carries half the body's weight as well as the additional force exerted. For example, each time the body engages in physical activity, the force behind the body's movement is multiplied by the force exerted on the hip joint by the body's weight. Because of this, the hip must be able to accommodate extreme forces. The hip joint involves many hip and thigh muscles as well as muscle tendons, which help keep it stable and strong, allowing the leg to move in many directions. These muscles can be categorized as posterior, medial, and anterior muscles. The posterior muscles include the gluteus maximus and the gluteus medius. The biceps femoris is lateral to the semitendinosus muscle and the semimembranosus muscle. The anterior muscles, like the adductor longus and pectineus, both allow the leg's flexion, adduction, and medial rotation, whereas the adductor magnus on the posterior side adducts, extends, and medially rotates the femur. A medial muscle named the gracilis, shown here, both adducts and medially rotates the thigh. All of these ligaments and muscles help prevent dislocations of the hip. A dislocation is defined as an injury to a joint where a bone is forced and thus moved from its normal anatomical position. When the joint dislocates, the ligaments, muscles, soft tissues, and nerves can and often are damaged. If the nerves in the hip are damaged, it is likely that you will not have feeling in the foot or ankle. However, it takes great force to dislocate the hip joint because this joint is incredibly stable. Most dislocations are from a traumatic incident such as car collisions and falls. There are two types of hip dislocations: posterior dislocations and anterior dislocations. A posterior dislocation is the most common type, occurring in about 90% of all hip dislocations. This type of dislocation pushes the femur out of the acetabulum, leaving the knee and foot rotated medially, facing toward the midline of the body. An anterior dislocation occurs when the femur slips out of the socket in a forward fashion. This dislocation causes the lower leg to rotate laterally away from the body's midline. Because the hip joint is so frequently used, the hyaline cartilage can get worn down from overuse. For instance, osteoarthritis is a degenerative joint disease where, over time, the cartilage which cushions the hip joint wears down. This wearing down can be due to aging, trauma, or overuse. As the cartilage wears down, it becomes frayed and does not protect the joint space as it should. As a result, the bones will rub together each time the body moves, and this can be extremely painful and end up causing stiffness and movement. Medically, arthritis of the hip can be treated in one of two ways: a total hip replacement or a hip resurfacing. A total hip replacement is a surgical procedure where parts of the bone that are diseased or worn down are replaced with new, non-irritating man-made materials. This artificial part is called the prosthesis, which mimics the function of a joint. The goal is to improve the function of the hip and relieve the pain. Whereas a hip resurfacing is the other surgical procedure that conserves more of the proximal parts of the femur. This procedure is most common in younger, more active patients because it is not as invasive and preserves as much of the femur as possible. However, there are multiple ways to prevent the joint's cartilage from wearing down. Before exercising, the muscles of the body should be warmed up and stretched if possible, and most importantly, stop if any pain is experienced. All in all, the hip joint is an amazing part of the human body. Without it, the body could not move as it does today. It is the foundation for the leg movement, involving many major leg and thigh muscles, strong ligaments, and tendons. Its unique structure makes it an incredibly stable and extremely flexible joint. Without this joint, the body could not be able to stand, sit, stretch, walk, run, or even do yoga. I made this video for anatomy at Saddleback College. Have a very hippie day.